Okay. So thank you all for attending today. Again, my name is Amy Hall. I'm from J.S. Clark Agency, and the purpose of our presentation today is to walk you through the 2015 employee benefit offerings for American House. Your open enrollment has begun, and so today we are going to spend time walking through the benefits, making sure that you have an understanding of the benefit options for 2015. We want to make sure that you understand the enrollment process and want to get any questions you have answered for you. So I think the best way to do that will be if you can funnel those questions through the chat function. But if not, please just pipe up and we'll get your questions answered as we go through. As far as trends going on in our industry, we've got a lot going on. One of the primary things right now is healthcare reform, also referred to as the ACA, PACA, all terms relative to that, and a huge piece of legislation that has pretty significant impacts on our business today. Healthcare trend is at about 7 to 8%, so leveling off a little bit from years where we had double-digit increases. The prescription drug market continues to flourish, especially in the area of specialty drugs. So many of you may be familiar with the terms generic and brand. Some of you may be familiar with specialty medications. More and more, you'll hear more about that simply because there are more and more specialty medications becoming available, as that's where most of the pharmaceutical companies are concentrating their efforts. We've got diversity in the workplace, and basically Americans are living longer, healthier lives, allowing them to work longer. And so it's always a challenging situation for employers to develop a benefit program that's for everybody with the different medical needs they have for themselves and their families. And because of that, we see a lot of different things going on as far as cost-sharing strategies. So plans that are offered are designed differently than they once were. You have to become familiar with deductibles, co-pays, co-insurance levels that ultimately define how much you're responsible for when you receive services. And then clearly we also have a lot going on just from a premium contribution standpoint, where there's typically some type of funding going on from the employer and also some sharing in that cost from the employee as well. And I'm happy to report that for the first time, American House is providing medical benefits, and so we'll be walking through those two plans that have become available to you for January 1st. And they're funding 76% of the single premium, which is real exciting news. I don't get to say that very often. But as we move forward, I want to make sure that everybody has an understanding of some of the primary things going on with healthcare reform right now. One of those items is referred to as employer shared responsibility. This is effective 2016 for your group and is also referred to as the employer mandate. And basically what it says is large group employers must provide minimum value coverage and provide affordable coverage or face tax penalties and fees. Okay, so with the onset of the medical plans becoming available to you, your employer is compliant with the employer shared responsibility provision of healthcare reform. In addition, there's an individual shared responsibility provision that went into effect on January 1, 2014, also referred to as the individual mandate. And this basically states that all U.S. citizens must have minimum essential coverage or face penalties. So penalties went into play January 1 of 2014. Not many people are really talking about it much because no single person has actually paid one of those penalties yet. Those penalties will be assessed on the individual income tax return that's due sometime before April 15th of 2015. So at that point, anybody who went without coverage for 2014 will be assessed the fine or penalty, as you will. It was less in 2014, and then for 2015, it is the greater of $295 or 2% of your household income. Just to put that into perspective, if you have a household income of $40,000, then 2% of that would be an $800 penalty. And then those penalties will index up every year following. There are some exclusions that apply to those penalties being assessed, and I won't walk through all of them. There's a pretty comprehensive list and a little more leniency for 2014 than there is for 2015, and all of that information could be found at hhs.gov. In addition, because of the mandate to coverage, many of us have been able to secure coverage through an employer for some time now. However, accessing individual health insurance coverage could be pretty problematic prior to January 1, 2014. So with the onset of health care reform and this requirement to secure coverage, the legislation also addressed creating access to that coverage. So for individuals, we now have the individual marketplace, which has been open since, prior to January 1, 2014. But this is a place where individuals can go to shop for insurance and achieve receiving a subsidy if, in fact, they do qualify for a subsidy. Now, just to be clear, because American House will be providing coverage that exceeds the minimum value requirement and exceeds the affordability requirement, anybody who is eligible for this plan here through American House would no longer be eligible for subsidized coverage through the marketplace. So objectives for American House for 2015 is, 1, to meet the employer shared responsibility requirements of PACA, provide options that provide value to employees and their families, encourage a healthy workforce, and achieve cost effectiveness for American House and their employees. So a little more specifically, the benefit program available through American House for 2015 will include 2 priority health, medical, and prescription plans. We'll refer to the first one as the base plan, which is one of their HMO value plans. And there's a buy-up plan available that provides a little more coverage in certain situations. That's referred to as the HMO traditional plan. You currently have 2 principal dental plans available to you. The base plan, which they refer to as the PPO low plan, and the buy-up plan, which is referred to as the PPO high plan, and those for 2015 will be exactly the same as they currently are. There's no change to those plans. The iMed Vision plan also remains in place, and there's no change to that. There's also a short-term disability plan through Unum that's available to employees, and that too remains exactly the same, as well as the principal life insurance and accidental death and dismemberment plan that remains in place with no changes. In addition, for those enrolled in the Priority Health Medical Plan, either one of them, Priority Health also provides 2 additional benefits. The first one referred to as Assist America, which is a travel assistance benefit that provides more coverage for folks who run into situations where they need medical care when they're traveling, and that's whether you're inside the United States or outside the United States. And in addition, they provide a virtual doctor service, which allows their members to contact a doctor by phone to diagnose and treat real common medical situations. And I'll go into more detail on both of those. Okay. If there's no questions, then I'm going to take a deeper dive on the medical plans that are being offered. Great. So both of the plans are Priority Health HMO plans. So an HMO is a health maintenance organization and requires that you do choose a primary care physician within their network and use network providers for all of your services, unless you run into an emergency situation and go to the nearest emergency room for any life-threatening medical conditions. But the benefits you see detailed on this screen detail the coverage levels as long as you remain in the network. Both plans have 100% coverage for preventive care. So this is one of the provisions of healthcare reform that requires the plans to offer preventive care coverage at 100%, meaning no deductible, no copay, and no maximum on the amount that they'll pay out. In the packets that were distributed, you'll find about a 6 to 8 page guide from Priority Health that details what a preventive service is. Okay, so As you're going for your preventive care, you can take a look at this. It's a very comprehensive list that identifies what's preventive versus what's diagnostic. And we'll give you those details in many different ways, whether it's by age, whether it's by, immunizations, drugs, doctor's visits. It's all detailed in that. And actually, it's a 12-page document, okay? In the Priority Health Value Plan, so this is the base plan, which is the least expensive plan for you to participate in, you would have a $2,000 individual deductible, $4,000 for a two-person or family contract. Once the deductible is met, the plan would pay 80%. You would be responsible for 20%, which is the coinsurance level. I do want to point out that the coinsurance is a 50% coinsurance on a couple of procedures, and you'll see those details in your materials from Priority Health. The coinsurance maximum, so as you're paying your coinsurance, the 20%, that accumulates toward a maximum of $2,500 for a single contract or $5,000 for a two-person or family contract. In addition, the plan has what we refer to as a TROOP. That's a true out-of-pocket maximum. So your deductible, your 20% coinsurance, and any copays that you're all apply toward the true out-of-pocket max. If somebody was to reach that true out-of-pocket max of $6,350, then you would have 100% coverage for all covered services for the rest of the calendar year. The TROOP for a two-person or family contract is $12,700. Prescription copays are set on a three-tier basis, and what that means is you would have a $20 copay for generic, $60 for brand name, and $80 for specialty medications. Keep in mind that every insurance company also has what they refer to as a drug formulary or a drug list. They're available at the Priority Health website, and that will identify for you all of the medications that are covered by Priority Health. There will be and can be at times medications that Priority has chosen not to cover at all, and typically that's going to be in a situation where they could be considered experimental, or it could have been determined that they've already got medications within their drug list or drug formulary that provide the same results. In this plan, you'll find that for an office visit to your primary care physician or to use a virtual doctor, there's no copay. So this is one of the features of the plan that the management team at American House really liked. The ability to see my primary care doctor with zero copay, zero cost for that office visit consultation. The one thing that I want to point out is that that coverage applies to the office consult charge. So for instance, if you go in to see your primary care doctor and while you're there, they do a strep test, there is going to be a charge for that lab. And labs, as you'll see below, go toward deductible and then the 20% coinsurance level. So I don't want to give you an impression that there's no fee to see your doctor at any time. When you see your primary care physician, you have zero copay, so that is covered in full. However, if there are labs, x-rays, or other services associated with that visit, those will typically fall toward deductible and then coinsurance. If you seek care from a specialist, you can do so without a referral as long as you stay within the Priority Health HMO network. That cost does go toward deductible in this plan, and then once your deductible is met, you would be responsible for 20% of the cost. All facility services, including labs, x-rays, other radiology tests like MRIs, MRAs, PET scans, and CAT scans, too, go toward deductible and then a 20% coinsurance level. Okay? The traditional plan offered is a buy-up option, so it would cost more to participate in this plan. It, too, covers 100% preventive care. and then has a little bit lower of a deductible. It's $1,500 for a single contract or $3,000 for a two-person or family contract. Once the deductible is met, the plan pays 80%. You would be responsible for 20%. And again, there are a couple procedures that are at a 50% coinsurance level. The coinsurance maximum is $2,000 for a single contract and $4,000 for a two-person or family contract. The true out-of-pocket maximum on this plan is the same as your base plan at $6,350 for a single and $12,700 for a family. Okay, so if I stop there for a minute, let's just say somebody's hospitalized and incurs a $50,000 charge from the hospital. In that case, on the value plan, they would be responsible for the $2,000 deductible and then 20% up to the $2,500 max, so a total of $4,500 for a covered hospitalization. On the traditional plan, if we take a look at that same claim issue, you'd have a $1,500 deductible and then 20% up to another $2,000, $3,000. Also on the traditional plan, you'll see that the prescription copays are a touch less. $15 for generic, $50 for brand, and still $80 for specialty medication. Now on this plan, if you seek services from your primary care physician, there will be a $25 office visit copay, and that's the same if you use the virtual doctor service. However, specialist office visits are covered at a $40 copay. Again, as a reminder, all facility services, including labs and x-rays and other radiology tests, will all go toward deductible and then the 20% coinsurance. Is there a question? Hi, I am having a hard time hearing. Is there a question? Okay, I'm going to keep going. I'm not hearing you. If there's a question, you may want to try the chat button on the computer, which I'll show is right here.
If I hit this button, the screen went blank.
What do you think? Okay. Again, I'm going to keep moving. It sounds like there's some conversation going on that's coming across for the whole group. If there's a question, I'm happy to answer it. Okay. So in a general sense, the value plan is being provided and really would seem to fit well with the type of person who doesn't have any known specialty care that they're going to need, doesn't have any known surgical expenses or hospital-type expenses, because it really provides coverage for a catastrophic event, as well as access to your primary care physician and all of your preventive care at 100%. The traditional plan might be more considerable for somebody who has maybe a chronic situation where they need to see a specialist on a regular basis and or have more prescription needs and would benefit from the lower copay amounts. So those are some of the types of things that you'll want to consider as you determine which plan may better suit you and your families. Okay? A couple other things with the Priority Health HMO program. Members are required to designate a primary care physician. If you don't designate one on your form, they will designate one for you, and they'll do that by simply using your zip code and finding one close to you. Keep in mind, you can change your primary care physician at any time to another primary care physician in their network, and just simply need to notify them through their website or through their customer service line, and those changes are effective on the first of the month following that communication. Another thing to remind you of, we always recommend that if you are a new patient to a primary care physician, to schedule your new patient preventive visit immediately. This is one of those things where once you've done that, if you then need to get into the doctor, let's say a month or two later, for a diagnosis or a problem that you're having, they're going to be much more capable of getting you in quickly because they've already got a health history on you and they've already done that new patient visit. If you wait to do your new patient visit and find yourself in a situation where you need to see a doctor because of something that's going on, those are situations that a lot of times you may be told that you first have to have your new patient visit, and it may take 2 or 3 weeks to get that scheduled. In large part, doctors do not designate as much time in their week for new patient visits as they do for visits from existing patients who are experiencing some type of medical problem. A reminder that if you receive a prescription for a medication that actually costs less than the copay amount, you will only be charged that amount. So a lot of us are familiar with the ability to get some real common antibiotics from different retail pharmacies for $4. That remains available to you, and anytime the cost is less than that copay amount, you'll only be charged the actual cost of the prescription. Priority Health also refers to their HMO as an open access HMO, meaning you do not have to get referrals to seek a consult with a specialist. As long as you remain within Priority Health's HMO network, then you do not need a referral to see a specialist. Again, there are no out-of-network benefits except for life-threatening medical emergencies. So if you do seek emergency treatment, as long as it's for a medical emergency, then you would have coverage for that if you use a non-network emergency room. But otherwise, you do need to remain in the network to achieve the benefits that we walked through. In addition, if you are covering any dependents who live out of the area, you do need to notify Priority Health. They will make arrangements with you to identify if there's a different network in their particular area that they need to access in order to be covered. I mentioned the virtual doctor service, and so Priority Health provides that to you at no additional cost to you. Again, it's the primary care physician copay that applies for the service. So in the value plan, it's $0. In the buy-up traditional HMO plan, that cost is $25. The MD Live service is available to you 24 hours a day, 7 days a week. You would want to use this service in non-emergency situations, and a lot of times when you're in need of care outside of your doctor's normal business hours. Nights, weekends, holidays all work, and sometimes I've even found people to use it while their doctor is open, just to be able to get a little quicker access to a physician, especially if it's a real common situation where you just simply may need to have a prescription called in. It's also accessible while you're traveling. They are qualified and licensed to be able to treat, again, some of the most common situations: cold and flu, fever, respiratory infections, sinus infections, and sore throats. The MD Live doctors are U.S. board certified and state licensed. The virtual visits through MD Live are secure and HIPAA compliant. You do need to register. We encourage you to register ahead of time, which you can do through the Priority Health website by just clicking on the MD Live logo or by the phone number provided, which is in your packets as well. They simply need to get a health history on you before any doctor would be able to diagnose or prescribe medication to you. So even in the event where you don't do this ahead of time and you want to use the service, over the phone it typically takes about 15-20 minutes to go through the health questions with them and provide a history. The screener will ask you about the symptoms you're experiencing, and then a doctor will call you back within a 2-hour time frame. I also recommend that you have your local pharmacy information available so that if they are going to call in a prescription for you, They can get that number from you immediately and kind of get you on your way. In addition, for anybody who is enrolled in the Priority Health Plan, we encourage you to become familiar with PriorityHealth.com's Member Center. You can create a personal and secure logon where they provide all types of services, such as completing a health assessment. They'll, too, go through a health history with you, identify if you could be at risk for any potential medical conditions in your future, and provide some education and coaching around that. You can view your benefit and claims information. You can use the Healthcare Blue Book, and this is a pretty innovative piece that Priority has really been the leader in. But ultimately, they've loaded into this Healthcare Blue Book about 350 common procedures. And so if you're told you need to have, let's say, surgery on an ACL tendon, you could literally go into the Healthcare Blue Book, put that service in, and it will identify for you what the approved charges for that particular service at many of their different participating hospitals or facilities. So even though you have a choice in who you want to use and what hospital you want to go to, as long as it's in the network, costs can differ pretty significantly. And because we all have deductibles and coinsurance levels today, it's important to get that information ahead of time to understand what you're going to be responsible for, and even to shop those services to see if there is another facility that offers a lower cost that you and your doctor are comfortable with as well. They also load their approved drug list, so I had mentioned that. The drug list will tell you, 1, if it's a covered medication, 2, what tier copay it will fall to, and 3, they'll also identify for you if there are some alternatives that are available that might be appropriate for your care. So if you find yourself with a prescription that falls to that $80 tier, you can look up on the approved drug list. Priority will list any other alternatives that could be available, and then clearly we always want to make sure that you're communicating back with your doctor in that regard, but you may be able to bounce those off your doctor and find one that's less expensive that is just as effective. So keep that in mind too. You can sign up to receive your explanations of benefits electronically, verify coverage for everyone on your contract, and also take advantage of Health Fit discounts. So an example of one of the discounts they offer is at Dunham Sports. So if any of you will be doing any shopping at Dunham Sports anytime soon, and you present your Priority Health card, then you can receive up to 10% off of your purchase. They believe up to 20% on safety items like helmets and such. You can also register there for the virtual doctor service so that you're ready to go in the event you need to use that service. Any questions on medical before I go into dental? Great. The principal dental plans remain exactly the same, and 2 options are available to you, the PPO low plan and the PPO high plan. The PPO low plan requires that you use a principal PPO dentist. There is no out-of-network benefit available. So if you enroll in this plan, you must remain in the principal PPO network. There's no deductible. Preventive care services, which are the 2 routine cleanings every year, are covered at 100%. Basic services are covered at 80%, and major services are covered at 50%. There's no coverage for orthodontics, and there's an annual maximum payout from principal of $1,000. Periodontal and endodontal services will fall to either Class 2 or Class 3 levels, being covered at either 80 or 50%. The PPO high plan allows you to use the principal PPO network to achieve the best cost. However, there is a reduced benefit that's available to you if you choose to go out of network. So you have the option, if you enroll in this plan, to go out of network. Just recognize that you will have some additional costs to do that. There's no deductible, and again, preventive care is covered at 100%, basic care is covered at 80%, and major care at 50%. There's no coverage for orthodontics, The annual maximum on this plan is also $1,000. And then you may notice that periodontal and endodontal services are covered at Class 2. So at the 80% level instead of the 50% level. In addition, this plan offers a maximum accumulation benefit. And what that means is that for people who are enrolled in this plan, as long as you receive at least one service throughout the year, they'll allow you to carry over some of your unused benefit. Okay, so again, they provide a $1,000 maximum benefit. And in this plan, let's say you go for your 2 routine cleanings, and let's say that accumulates to about $240 in cost. And let's say you have nothing else done. That means that you haven't used $760 of benefit. Well, again, in this plan, as long as you receive one service for the year, they'll allow you to carry $500 over of your unused benefit, so that the following year, your annual maximum would be $1,500.
Well, if you took the lower plan, you could carry money over?
No, you can't, it's the higher plan.
I don't know.
Cool.
Right, so you're still paying, no, you're
Please.
getting, they're still paying for it, but paying the double the money though. You're paying $80 versus 46, 81 or 82, still getting that money from you. Check out that money out. I don't have to take it this year, but if I did, I'd probably just take the lower one.
Well, the vision, they only have one.
I'm
Right,
the same, life insurance is the same.
Okay. So I think I heard the question, does the low plan have the accumulation benefit? And the answer to that is no. Okay. The iMed Vision plan remains in place. They have their own network referred to as the iMed network, and they contract with a lot of the retail eye vision providers, as well as some independent ophthalmologists and optometrists. Eye exams are covered with a $10 copay, lenses with a $25 copay, and they allow $130 toward the purchase of frames. Contact lenses are also available in lieu of standard lenses, and there's a $130 allowance for that. You're eligible for an exam and lenses once every 12 months, and for frames once every 24 months. And here, too, if you choose to go outside the iMed network, you can do that, but you'll have higher out-of-pocket costs because those providers are not obligated to accept iMed's reasonable and customary fees.
I wish we had these graphs, regularly now.
The short-term disability policy remains available. If you are already enrolled, you can keep your current amount in place. There is a 14-day elimination period, so if you become disabled due to accident or illness, the benefit would begin after 14 days if you are enrolled in the plan. At that point, it would provide 60% of your weekly earnings up to a maximum of $1,500 per week. The benefit would pay for a maximum of 13 weeks if you remain disabled for that time. There is a pre-existing condition exclusion. It's referred to as a 312 pre-ex clause. And what this means is for any conditions that exist within 3 months prior to your effective date, then coverage for that condition will be excluded for 12 months after the effective date. They will issue this on a guaranteed basis when you're initially eligible. However, if you've been eligible in the past and waived coverage and now are looking to enroll, you will have to supply evidence of insurability or a health questionnaire for them to review before they'll determine if they will provide coverage or not. The principal life insurance also remains available and does include an accidental death and dismember benefit. All current amounts here, too, remain in place unless you decide to make a change. You can purchase coverage for yourself, your spouse, and your child or children. And here, too, the guaranteed issue amounts that you'll see detailed in your employee guide apply when you're initially eligible only. The guaranteed issue amounts do not apply at open enrollment every year. So if you've waived in the past and you're going to apply now, you'll need to complete an evidence of insurability form. Or if you're enrolled now and have decided to increase your amount this year, then there too you would have to complete an evidence of insurability. And just a reminder here to update your beneficiary. You would have been asked for beneficiary information if you already had enrolled, but as a reminder, we just like to make sure that you give that some thought. If you've had any changes in your life, we'd ask that you make sure you update your beneficiary. We hope never to have to access that information, but if we do, we simply want to make sure that those monies are going to the right person. Okay, so as far as cost to be enrolled in any of the plans, this slide details for you what the cost of each of the plans are, depending on whether you're a single, a two-person, or a family contract, and that's your choice. However, if you are going to look to enroll a spouse or children, you do have to be enrolled. You would not be able to just enroll them without enrolling yourself. For the Priority Health HMO Value Plan for single coverage for the employees, the contribution amount is $46.75 per pay. So pretty exciting news there. And as mentioned, that does exceed the affordability threshold for all employees of American House. If you decide to buy up to the Priority Health Traditional Plan as a single contract, then that contribution becomes $81.13. The Low Principal Dental Plan requires a contribution of $9.98 per paycheck, and the High Plan requires $16.80 per paycheck. The iMed Plan is a cost of $2.66 per pay. As you'll see in glancing at this slide and in the materials provided in your packet, if you are adding a spouse or any other second person, so two-person could be employee and spouse, or it could be employee and child, or family, those prices do start to go up. And so again, all of that is detailed here for you, as well as on your election form, which is in the packets you received. Short-term disability premiums and life insurance premiums vary based on the age and coverage level you select. So that will be calculated on your election form, and I'll go through that with you in a few minutes. The short-term disability premiums and life insurance premiums are post-tax, while all of the medical, dental, and vision premiums can be taken on a pre-tax basis.
I'm not doing this, I'm covered right now. I always take the dental, and I take the vision for
Okay. Are there other questions?
I don't know, I use both insurance benefits.
Okay. So just a couple other notifications with regards to healthcare reform. Following open enrollment, once you've identified which plan you're going to enroll in from a medical perspective, or if you're going to enroll in a medical plan or not, for those of you who are enrolled, you will receive what's called a Summary of Benefits and Coverage, also referred to as an SBC. It's just another form that details the benefit offerings in addition to the employee guide that you received that gives you kind of a side-by-side comparison, and the two Priority Health summaries that were in your packet as well that provide a little bit more detail. Marketplace notifications also had to be distributed within about the last year, and basically that notification would have provided to you information with regards to the Michigan Marketplace and would have given you information to reach hhs.gov, and also would have identified for you at that time whether or not your plan met the affordability threshold and if it met the minimum value threshold. And so in the past, you may have received one that said, no, it doesn't meet minimum value or exceed affordability, because prior to January 115, there was no medical plan being offered. So the status of your employer's plan, again, as of January 115, exceeds minimum value and exceeds affordability. So for anybody who may be receiving subsidized coverage through the marketplace right now, you need to make sure that appropriate communications take place with your agent or direct with the marketplace representatives to make sure that you do not continue to receive subsidized coverage as of January 1st. Okay, so as far as the enrollment process, again, wanted to just walk through a review of the benefits and then help you understand everything in your packet. So in your packet, you have what we call an employee guide that gives you all of the contact information for all of the insurance companies that are in place. If you start to walk through, it will give you much more detail on all of the plans that I just covered in summary form. In addition, we provided the Priority Health 2015 Preventive Health Care Guidelines to you. We provided an additional Priority Health summary of each of the plans, the HMO Value Plan and the HMO Standard Plan. We provided the Group Health Plan Service Area for Priority Health, which on the back side of that page identifies all of the participating HMO hospitals. And then you've got what we call an enrollment waiver form. This form is a 3-page form and is white paper with a lot of red and blue all over it. And this is the enrollment form that you'll need to complete, whether you're enrolling in all of the benefits, waiving all of the benefits, or some combination of enrollment and waiving these benefits that are available to you. You'll need to complete these and turn these election forms into your executive director by next Tuesday, December 16th at 4 o'clock. Okay? Please keep in mind, if you do need to designate a beneficiary, you'll need to get an additional document or form from your executive director. And evidence of insurability is required for any employees enrolling in for the first time and or increasing voluntary life insurance coverage or short-term disability. Please also keep in mind that the elections you choose for January 1, 2015 is for the plan year, which is through December 31st, 2015, unless you have what's called a qualifying event or a family status change. Examples of family status changes would be, I got married and need to add my spouse. I had or adopted a baby and need to add the child. Divorce, need to take a spouse off the plan. Another situation we run into commonly is maybe you've waived coverage here through American House because you're getting it through a spouse, and your spouse gets laid off and loses that coverage. That's a loss in coverage. That's a qualifying event that would allow you to come onto this plan. The main thing to keep in mind anytime you have a family status change or qualifying event is that you need to notify your executive director so they can be in touch with your human resources department rather immediately. There's only a 30-day window of time for us to get all of the process with the insurance company, and it's got to go through several steps in order for that to happen. So please don't delay when you have a qualifying event. Notify your director immediately. Again, the deadline to submit the election form is Tuesday, December 16th at 4 o'clock. Please understand that Priority Health cannot guarantee that you will have ID cards in your mailbox or in your wallet before January 1st. However, if you do elect the coverage, it is effective on January 1st, and you could expect to receive your ID card before January 16th. Okay, any questions? Okay, if there are no questions, I'm going to go ahead and close the presentation. Thanks again for your attendance. We hope to be able to secure everything for you as you wish. And so in order to do that, fill out the enrollment or waiver form. And again, even if you're waiving all benefits, we do need to have that indication clearly from you on the enrollment form. So again, we can secure any coverage that you have elected and make sure that it's in place for you on the January 1 effective date. Thanks again, everybody. Goodbye.